Hello, welcome to Erectile Dysfunction 101. Today we're going to be discussing the causes, risk factors, and treatment options available for erectile dysfunction. Today we're privileged to have a special guest here. His name is Pedro, and he is currently suffering through erectile dysfunction. So, can you tell me a little bit about your problem?
Well, I have erectile dysfunction, so I'm seeing if you could tell me a little bit more about erectile dysfunction.
Okay, alright, fair enough. Well, it's important to define what erectile dysfunction is. See, erectile dysfunction is the inability to keep an erection firm enough for sex. Now, this may either be temporary or a chronic problem. If it's a temporary problem, for example, if it occurs like 20% of the time that you try, it's not unusual and does not require treatment. However, if this continues to be an ongoing problem and it takes you more than 50% of the time, then it indicates that treatment is required. Okay, so what are some other questions you have for me?
I just want to know like the different causes that might cause me to have erectile dysfunction, and what are some things I might be able to do?
That's an excellent question. Understanding the root cause of the problem is key when dealing with it. Okay, so let's go ahead and talk about the causes of erectile dysfunction. First, I want to point out that there are two main types. First, there's physiological types and there's psychological types. Now let's talk about the 5 physiological types of erectile dysfunction. We have physical system conditions such as congenital sexual physiologic problems and paraphilia that causes erectile dysfunction. And that is the fear of sex, which is rare. Another physiological cause includes physical illness. Now this is a major factor that causes erectile dysfunction. Erectile dysfunction is can actually be a sign of vascular disease. Now, it's important to point out that people who have vascular disorders such as diabetes type 2 have a high uncontrolled blood sugar levels, which actually damage the blood vessels and inhibit blood flow to the penis. Now it's important to understand that vascular disease is directly related to erectile dysfunction because it impairs the circulation that goes throughout your body. So that's very important. So physical illness such as diabetes type 2 or other vascular disorders is another type of erectile dysfunction. The third type of physiological erectile dysfunction include physical injury. Now that can be due to prostate surgery or things like that. There's drug side effects. A lot of times they take blood pressure meds such as antihypertensives that can cause erectile dysfunction. And then the last physiological type is lifestyle issues, which include smoking, poor physical conditioning, and obesity. We're going to be talking more about those lifestyle issues a little bit later. But for now, I'm going to talk about the 4 psychological types of erectile dysfunction. Now, the first one is psychological system problems. This is when someone who has a mental disorder, such as obsessive compulsive disorder, general anxiety disorder, which often occur infrequently. So that's not something to worry about. The second one is psychological distress. Now everyone goes through some type of distress one way or the other. That could be through work, through anxiety, grieving, which is often common. Another one is relational distress. You may have arguments with your spouse, which can cause you to, not have an erection due to your stress that, oh, you're not feeling it in the moment, things like that. And then another one is psychosexual skills deficits, which is very uncommon. An example of that is unrealistic expectations. For example, if somebody is used to watching pornography and they see a lot of those fantasy situations, they may in fact become unsensitized to that material and may expect the same things from their spouse or their sexual partner. And if that sexual partner can't live up to those expectations, then they're unable to sustain an erection. Okay, so those are the 4 types of psychological types of erectile dysfunction. Now, you may ask, what are the risk factors, right? That's what
risk factors and some treatments.
Okay, so let's go ahead and talk about the risk factors. When we talk about erectile dysfunction, a lot of people think that erectile dysfunction is directly related to age. But I'm here to tell you that according to National Institute of Health, only approximately 5% of 40-year-olds, 40-year-old men, suffer through erectile dysfunction. And 15 to 25% of 65-year-old men experience chronic erectile dysfunction. So age is not necessarily a key factor in developing erectile dysfunction. Key factors include the lifestyle factors, which I was mentioning earlier, which include smoking. As you know, smoking can increase blood vessel disorders and damage the circulation throughout the body, and cause arteriosclerosis and high blood pressure. Another thing that may affect as a risk factor is alcohol use. Now, what alcohol use does is that it depresses the central nervous system and impairs sexual function. So, I don't know if you've had personal experience of being drunk and unable to sustain an erection.
Might be the cause sometimes.
Okay, well, it's good to admit those things. Drug abuse. Drug use is another important thing. Illicit drug use such as heroin, cocaine, methamphetamines, and marijuana can affect sexual function. And the last thing is a sedentary lifestyle. Sedentary lifestyle can lead to obesity, which can lead to other health problems associated with erectile dysfunction. So with that in mind, it's important that you prevent yourself from, doing those activities. So if you're currently taking drugs, doing alcohol, smoking, it's important that you stop doing that to reverse those negative effects that it has on your body. Not only for preventing erectile dysfunction, but actually maintaining a proper healthy life. Because erectile dysfunction is minor in comparison to the damage you're doing to your body. Okay? So you wanted to talk to me about what treatment options are available? Well, it's good to know that there are a lot of treatment options available for people who suffer through erectile dysfunction. The first thing I want to talk about or mention is, like I said, changing those lifestyle factors. If one person refrains from doing those sedentary lifestyle activities, you can actually prevent the vascular disorders or the lack of blood circulation throughout the body. Okay, so lifestyle changes is important. Another thing that you can do is talk to a sex therapist. What a sex therapist can do is work with you and your spouse in ways that you can stimulate an erection together, probably in ways you haven't really thought of. Sex therapists know very many techniques and can be very helpful. Now, a popular way to treat erectile dysfunction is actually working with impotent drugs, such as Viagra, Levitra, and Cialis. Are you familiar with these drugs?
Yes, I am.
Yeah, I mean, they're pretty popular on television. You can't miss them. But they actually have been proven to be very effective for dealing with erectile dysfunction. So you can go with that option. We're going to be talking more about those drugs a little bit later, but for now I'm just going to continue on what options are available. Another option is erectile dysfunction vacuums. These are penile vacuums that actually suction onto the penis and draw blood into the penis. Now, this can be very effective, but one downside is that these vacuums can be very costly. I've heard that they can run from $100s to $200s to even $300, depending on what type you get. So, if this is not really your style, then I wouldn't recommend it. Another thing that has become very popular nowadays is penile implants. Now, penile implants have served to be a permanent solution to erectile dysfunction, and couples have been opting to go that route. But you should definitely talk to your doctor before you get any penile implants. But that can serve to be a permanent solution. Another option that you have is erectile dysfunction surgery. Now, this is special surgery that is designed to improve the blood circulation into your penis. Okay, so that option is available. There's also natural remedies that are used to improve blood circulation throughout the body, and things like that. So now let's talk about those drugs that I mentioned earlier. Viagra, Levitra, Cialis. All of these drugs are popular drugs that are used to treat erectile dysfunction. But it's important to understand that before you take any of these drugs, that you consider the following. They say that you should not be taking any nitrate drugs for angina, such as nitroglycerin. You shouldn't be taking any blood thinning meds or alpha blockers for enlarged prostate, or even high blood pressure meds. You should not have heart disease or heart failure, have had a recent stroke, or currently have low blood pressure or uncontrolled high blood pressure, as well as uncontrolled diabetes. So it's important that you understand those factors before you take any of these meds. Now, the men that take these drugs, they have reported certain side effects, which include headaches, flushing, indigestion, stuffy, runny nose, back pain, muscle aches, and some visual changes and hearing loss. However, these changes are not really that significant in comparison to this specific side effect, which includes sustaining an erection for more than 4 hours. Now, this is not a problem to joke around or brag about, because of the fact that this side effect is very painful, because of all the high volume of blood that is stuck in your penis. Now, they say that treatment for this often can lead to aspirating blood directly from the penis through a needle. So, can you imagine sticking an IV in your penis? It must be very painful and uncomfortable. So, if you have any signs of sustaining an erection for more than 4 hours, you need to immediately contact your doctor and seek medical attention. So now that we've gone through the causes of erectile dysfunction, the risk factors, the treatment options available, and the side effects of certain drugs, I hope you understand how you can effectively treat your erectile dysfunction and make the appropriate changes to your lifestyle.
No, thank you so much.
Thank you. This concludes our lesson on Erectile Dysfunction 101. Thank you.